Welcome back to ophthalmology for undergraduates and postgraduate beginners. Certain cases are very commonly kept in the examination. Today we are going to see a simple anatomy before we are going to discuss the cases. This is the eyelid anatomy you should be thorough with. I have drawn the eyelid. This is the conjunctival side. This is the skin side. In the eyelid, I have drawn this blue thing that is called as the tarsal plate. Within the tarsal plate, you have a green colored gland that is called as the meibomian gland, which is opening through a duct into the posterior lid margin. The second thing is, you are able to see an eyelash here. There is a hair follicle into which multiple small glands are opening into this hair follicle. These glands are called as glands of Zeiss and mole. So this is a simple anatomy you should know about. In the video you just saw, you saw a swelling in the margin of the lower eyelid. There are two swellings and there was another swelling in the margin of the upper eyelid. You must have seen a swelling which is having all the signs of inflammation, all the 5 signs of inflammation which you should be able to recollect. There is a swelling. Apart from that, in the swelling, you must have seen a whitish area that is called as the pus pointing area. That pus pointing area is at the base of the hair follicle. Base of the hair follicle, that is what you should recognize. That swelling is called as the hordeolum externum or STYE. What is this hordeolum externum or STYE? It is the acute suppurative inflammation of the glands of Zeiss or mole. So this is the glands of Zeiss or mole. Because these glands are inflamed and swollen with the pus, what happens is there's a very big swelling at the margin of the eyelid, and this pus is just getting collected and it is about to come at the base of the eyelashes. The patient will be presenting with severe pain in the eyes and there will be some heaviness. There may be a purulent discharge from the eyes. There may be sticking of the lashes or matting of the lashes that may be present. The lid may be very heavy to the patient. So these are all the signs and symptoms of this hordeolum externum. Apart from the above signs and symptoms, whenever there is an inflammatory process in the eye, you can either have enlargements of the lymph nodes in the preauricular area or in the submandibular region. The lateral half of the eye is draining into the preauricular lymph nodes and the medial part of the eyelid or eyes are draining into the submandibular nodes. So you should also look into those findings. Now let us see what are the common etiologies or causes leading to this hordeolum externum. The first and foremost thing leading to this hordeolum externum or STYE is uncorrected refractory errors. A patient is having a refractory error, but they are not willing to get corrected with spectacles or any other means, then they are likely to get this swelling. The second thing is poor hygiene. They are not clean, they are not hygienic. That can lead to infections everywhere in the body and also the swelling in the eyelids. Frequent rubbing of eyes. Some people have the habit of frequently rubbing their eyes. When they do it, what happens is automatically they rub their eyes with their unclean or unhygienic hands, inoculating infections into the eye, causing the swelling. Diabetes. Diabetic people, they are prone for infections. So they are likely to get recurrent swellings in the lid margins. Immunodeficiency diseases also can lead to these kind of infections and swellings in the eyelid. This hordeolum externum is caused by an infection that is called as the Staphylococcus aureus. Now let us see how to manage a case of hordeolum externum or STYE. Normally we used to ask the patient to give warm compresses. They can wash their mouth and they can take a cloth, blow hot air into it and they can give warm compresses so that it will be soothing to the symptoms as well as it will cause the swelling to give away and all the pus and blood inside the swelling to come out so that the swelling collapses. Antibiotic eye ointments to be applied which are very effective against staphylococcus. The common antibiotic eye ointments used are ciprofloxacin eye ointment and tobramycin eye ointments. So here we have to use only ointments because it is in the lid margin. If you put eye drops will not act in the lid margin because they will pour down. So ointments only will stay on the surface of the swelling and it will act. Next is go for a oral antibiotic. Go for a oral antibiotic which is effective against this staphylococcus. Oral analgesics to reduce inflammation and reduce pain for the patient. Then ask the patient to be hygienic. Control diabetes mellitus if the blood sugar is high and the patient is already diabetic. If the patient is a refractory error patient, you have to give correction for that with spectacles or by other means to prevent recurrence of this swelling. Now you can ask, is there only medical management for this case? Definitely not. We have a surgical treatment also for this, but it should be done along with this medical management. What is the surgical management? That is called as epilation. Epilation is nothing but plucking the eyelash in that particular gland where the pus is pointing. Just remove it. Automatically the pus will come out freely and the swelling and pain may reduce drastically. That way we can do it, or we can make a small horizontal incision at the pus pointing area so that the pus comes out. You should give all this medical management following that. So this is all about this hordeolum externum or STYE. We will discuss about hordeolum internum in the next video.